we are going to see about the lingual artery. This is the lingual artery, and this artery is the principal artery of the tongue. It arises from the front of the external carotid. This is the external carotid. It arises from the front of the external carotid, just opposite to the tip of the greater corner of hyoid bone. This is the tip of the greater corner of hyoid bone. This is the hyoid bone. And sometimes it arises with the facial artery as the linguofacial trunk. The course of the artery is divided into three parts by the hyoglossus muscle. Before going to the details of the artery, let's see some muscles over this region. This is the hyoglossus muscle. This is the anterior border of the hyoglossus. This is the posterior border of the hyoglossus, and the hyoglossus is cut in between this region to show the deeper aspects. The hyoglossus lies in a superficial plane. This muscle, this is the stylohyoid muscle, and the muscle over this region, that is the middle constrictor muscle. These two muscles lie in a deeper plane than the hyoglossus, and also this ligament, that is the stylohyoid ligament, also lying in a deeper plane. Now we will see each part of the lingual artery. The first part that lies in the carotid triangle and extends from its origin to the posterior border of the hyoglossus muscle. It describes a characteristic loop, and with its convexity is directed upwards. This convexity helps in the movement of the hyoid bone. Here it rests on the middle constrictor muscle, and it is crossed superficially by the hypoglossal nerve. This is the hypoglossal nerve. At this region, the hypoglossal nerve is passing superficial to the first part of the lingual artery. The second part of the lingual artery, this is the second part, that is the part lying deep to the hyoglossus. It runs horizontally forward along the upper border of the hyoid bone, and it lies between the hyoglossus laterally and stylohyoid ligament and the middle constrictor medially. Here the artery is separated from the hypoglossal nerve. This is hypoglossal nerve. Here the artery is separated from the hypoglossal nerve by the hyoglossus muscle. The third part of the artery, that is also known as Arteria profunda linguae, that is the part of the artery lying anterior to the hyoglossus muscle. It first ascends along the anterior border of the hyoglossus, then runs forward beneath the mucous membrane of the under surface of the tongue on both sides of the frenulum linguae. The sublingual course of the artery, that is this part, it intervenes between the genioglossus, that is this muscle over this region, this large fan-shaped muscle. The sublingual course of the artery lies between the genioglossus medially and the longitudinal lingual inferior muscle laterally, and this part is accompanied by the lingual nerve. This is the lingual nerve. So the third part of the artery is accompanied by the lingual nerve. At the tip of the tongue, the lingual artery anastomoses with this fellow of the opposite side. Now we will look into the branches of the lingual artery. The first branch, that is the suprahyoid artery. This is the first part of the lingual artery, and it gives of the suprahyoid artery along the upper border of the hyoid bone, and it anastomoses with the artery of the opposite side across the middle line. Next branch arises from the second part, and that branch is the dorsal lingual artery. This dorsal lingual artery consists of 3 or 4 branches which passes upward and supply the mucous membrane of the dorsal surface of the tongue palatine tonsils and soft palate. This is the third part of the lingual artery, and it gives off the branch sublingual artery. This sublingual artery passes forward between the genioglossus and mylohyoid and supplies the sublingual gland, mucous membrane of the floor of the mouth and adjoining gum. Few branches of the sublingual artery may anastomose with the submental artery after piercing the mylohyoid muscle.